Welcome back to Data Driven Leadership. I'm your host, Jess Carter. Today, we have a powerhouse duo, Stephanie Puglisi from Colorado's Office of eHealth Innovation and Colorado Lieutenant Governor Diane Primavera. Hey guys, welcome.
Thank you. Thanks for having us.
Excited to be here.
We are so glad to have both of you. And so we're going to start off right away. There's a little bit of context I want to get into, but first, why don't you both, let's start with Stephanie, just introduce yourselves and tell us a little bit about the work you do and why it's important to you.
Thanks, Jess. And hello, listeners. I'm Stephanie Puglisi. I'm the director of the Office of eHealth Innovation in Lieutenant Governor Diane Primavera's office. We are in the great state of Colorado. Our office has the unique and fortunate opportunity to coordinate health IT throughout both state agencies and kind of the bureaucracy of the state, as well as across all 64 counties in Colorado.
That's amazing. That sounds like a brief job. Super easy.
Super easy, always clear, never any question.
Very black and white.
Yes, no gray area ever.
Well, and Stephanie, is there a why? What got you into this?
I have a background in public health, also in state and local government. And so this is kind of my dream job, honestly, especially working under Lieutenant Governor Primavera, who cares so much about people and their health and making truly a Colorado for all. And so I ended up here through, I think, a series of fortunate being in the right place at the right time and kind of gathering my skills along my career to get here. So it's been a long and winding road, but it is truly never boring here. I get to work with all kinds of brilliant and interesting people on a daily basis. And I think my why is truly that I think government can and should work better for our constituents. And that's true in the health IT world more than anywhere, I would argue.
I appreciate that. Thank you, Stephanie. Lieutenant Governor, what about you?
So I'm the Lieutenant Governor for the great state of Colorado. So in addition to being second in command and filling in for the governor when needed, I actually run several programs out of my office. So Aerospace and Defense is one, Colorado Commission of Indian Affairs, Colorado Disability Policy, Serve Colorado, which is AmeriCorps, and then the Office of Saving People Money on Healthcare. I'm the director of that. And under the Office of Saving People Money on Healthcare is the Office of eHealth Innovation, which is where Stephanie comes in. So, I've been both a patient and a policymaker. And so when Stephanie talks about how I really try and keep the patient in the forefront of my mind, that's really what it is. Because behind every piece of data, there's a human being. And ultimately, what we're trying to do is make sure that we improve access and quality of care for people in Colorado. And that's part of what the Office of eHealth Innovation is doing.
Wow, that's amazing. Thank you for sharing that. So I really do see this as kind of setting the stage for this conversation because the health world is really complex. I mean, just selecting your own options during open enrollment is overwhelming to a lot of people. And so when you talk about this eHealth, this Office of eHealth, can you guys help explain to somebody who's not a health person, they don't spend 45 hours a day or a week, thinking about it, what is an eHealth department or office and how does that play in the rest of healthcare or, departments of health?
I'll start and then Stephanie can jump in. So the Office of eHealth Innovation is a fancy way of saying we're using technology kind of behind the scenes. A lot of the work that Stephanie and her staff do is behind the scenes to make sure that people can get access to healthcare, to make sure that it's quality healthcare, to make sure records transfer. Stephanie's done a lot of work in the telehealth arena. So it's just kind of a fancy way of saying we're using technology to improve the health of people of Colorado. So Stephanie might have something more to add to that.
You're always a hard act to follow, Lieutenant Governor. She says it so beautifully and eloquently, and then I'm over here and the records move. And so that's the only thing to add really is, obviously myself included, this is really focused on making an individual's data move and speak on their behalf as they decide, right? Our belief is that each of us created this data from our experience, and it should be working for us as opposed to the opposite, where we're having to work for that data and to make sure that the whole picture of our health is really reflected to our latest provider.
That's amazing. So I'm assuming not every state has something like this office. Is that right?
Well, actually, Colorado leads the nation in digital tools and services that support the health of all people in Colorado. So, we're really proud of that. So I think they do have something similar.
Okay.
But I think Colorado really leads the nation in this work.
Wow. Okay. That is amazing. And so when you explain what the Office of eHealth Innovation is, which you've kind of done, what does make it unique? When you say that it's pretty incredible and pretty advanced, what does that mean?
Well, again, Stephanie works all the technology and the infrastructure, behind the scenes. But for example, it might mean that, say, you go down to Southwest Colorado and you're hiking and you break a leg and the doctor orders x-rays and lab work and whatever else they need to do to diagnose whatever your injury is. Then you come back to Denver where you live and, instead of the doctor here repeating all those x-rays and lab work and everything else, the records can actually transfer now, thanks to the work that the Office of eHealth Innovation has done. So that will save people money on healthcare, and it'll make, their access better and, more timely and that kind of thing. So that's one of the things that the Office of eHealth Innovation has worked really hard on, in addition to some of the telehealth work that we've talked about. And then I think later on in the program, we're going to talk a little bit about the social impacts and influences of health and how the Office of eHealth Innovation has been working to address those as well.
That's amazing. That image is really helpful, I think, for people too, when it's like, well, what does this all really mean? And it's, well, you've sat in the 6th appointment where you're writing down the exact same situation, an event that happened that caused you to be in the room. And is it your PT after you had surgery to repair a broken whatever? And it's the idea that there's a little bit less burden on you because you're already trying to heal. You're already trying to probably get back to work and take care of your kids and go to your 5th appointment. And the fact that it's like this one less thing to have to do sounds pretty important, I would imagine, actually impactful for outcomes.
Oftentimes when people are in a crisis situation or a traumatic situation, they don't always remember all the things all the tests, all the x-rays, all the everything. So you get back to Denver and the doctor says to you, well, what did they do when you were down in the southern part of the state? And you try and remember.
Right.
This will help to make sure that the doctor has all the accurate information at hand and doesn't have to rely on your memory.
Wow. That's an excellent point. And maybe then you don't have to go through, if it was traumatic, retelling that, right? Well, there's one other kind of term I wanted to have you guys define for me and just for listeners. Tell me about a community information exchange and what Colorado is doing in this space with the Colorado Social Health Information Exchange.
So a community information exchange is an infrastructure that enables data sharing from many different types of partners, similar to a health information exchange, but inclusive of partners and data beyond typical health data. So in Colorado, we've taken the principle of a CIE because we have to have an acronym for everything and expanded it to be statewide. We know that our communities are already doing incredible work to support folks beyond the walls of a traditional care setting. So with the COSHI, which is the Colorado Social Health Information Exchange, which is something I mentioned a little bit earlier, we aim to support that ongoing work by providing investments into technology and partnerships at the local level. We have approached this through a hub and a spoke model, which Stephanie can probably get into better than I can, where OHI is leading the development of a unifying architecture at the state level for the hub and partnering with communities at the local level to enable and learn from what is already working on the spokes. So, Stephanie, did you want to add anything to that?
The only thing maybe to tag in there too is on the community level, like Lieutenant Governor mentioned, we already know this work is happening and we know that communities have figured out what works best for them, as well as recognizing that each community has unique priorities and needs. And so we're really proud of this approach of both kind of the traditional top down, the state will build something for you, as well as the bottom up and saying, you're already doing this. We know that we're not swooping in with all fresh ideas to change everything you're doing. We want to recognize what you're doing, learn from it, invest in it, and then connect it to that statewide model. And so we just had a request for applications, or an RFA. Again, we love an acronym. Closed last week for that community kind of hub model. And so this is truly the first approach like this in the nation, and it took a lot of conversations with our federal friends to really emphasize the need for this to be paid for at the community level too. Kind of circling back to what is unique about our office, which our office is able to work really closely with our state Medicaid office to pull down federal funds and match every dollar that the state provides for our work with $9 at the federal level.
Wow.
So that makes the money go a lot further and really helps us to distribute it kind of downstream a lot more as well.
I am so impressed just because I think about, to your point, what's already been made clear to me is the value proposition of a citizen doesn't just stay in one part of the state. And the fact that there's this interconnectivity between different regions geographically to support a citizen is so neat. I'm sure there are communities within Colorado that couldn't afford something like this on their own. And the fact that the state can show up and the communities can show up and support each other in this model, that just seems like an unbelievable, really high value use of some of these funds. That's really exciting.
Thank you. We think so.
I think Stephanie's staff has done a really good job. They just completed a listening session around the state with many stakeholders and patients and things like that to talk about the work that they're doing and how we can better improve services throughout the state. So, I think sometimes people have the perception of government that we sit in an ivory tower and just make decisions and really don't get a lot of input, but it's really a participatory process putting this all together and putting our health IT roadmap together. And so kudos to Stephanie and her staff for doing that.
That's super neat. You guys have both talked about listening a lot already, which I think is really encouraging for data-driven leaders out there, that it's not just about telling everyone and pointing at where we're going. It's about listening first. So thank you for that. One of the other questions I had for you guys is, we've heard this phrase, social determinants of health, or people in health have heard that phrase. Maybe not everybody has, but why is there a focus on social determinants of health or health-related social needs? Why has this come up? Why is it critical to address those factors?
So, when the governor and I first took office, we had a conversation and, I emphasized to him that all roads lead to health. And so we actually have 2 health cabinets, one that involves directors of the different health-related departments, and the other one is all the other different departments. So, you think about agriculture. If people don't have healthy food, they're not going to be healthy. So research shows us that the social determinants, or we also call them the social influences of health, can actually be more important than the health care people receive. I think that was the World Health Organization talking about social determinants of health. Social determinants can account for anywhere between 30 to 55% of health outcomes. So it's things like, do you have a stable house to live in? Do you have access to clean air? Do you have access to quality education? Those kinds of things. And they can often hit underserved communities the hardest. So that's why it's really important to address the social influences of health. Addressing these factors is making Colorado one of the healthiest states and also one of the leaders in this kind of effort. So, I just think we can better support people's health holistically, reduce disparities and make healthcare more affordable and effective overall by addressing the social influences of health.
Well said. And I appreciate you explaining what a social determinant is, because I think that there are some people who are like, what is that? And I've had some examples, but it's helpful to say this isn't so much about what your blood pressure is. It's more about, do you have a safe environment that you're in, that you find yourself coming home to? Do you have access to food, clean water, et cetera? So that's really helpful. And it's interesting and neat that in healthcare, where we have a tendency to sort of close our view and look at your health, your blood pressure, your heart rate, that we are starting to see these other factors and realize that they are playing a meaningful enough role to become this much of a priority, which make sense as human beings, right? But it's like the data wasn't there before. So it's exciting to me that you guys have that. What I get really excited about, especially having helped with the governor's response in Indiana to COVID, is I'm looking and listening at some of these priorities, and I'm curious what the implementation of these things look like on the ground. Not just what does it look and feel like, but maybe also I have this imagination, I'll call it that because of the pandemic, a lot of state agencies did have to raise their bar on like health modernization, that they had to take on some new initiatives about new data sets, maybe some social determinants, et cetera. And I think some of them have landed, I'll make up a turret term, the problem of visibility. Now they have all this data, they've visualized it, they can see it, and they don't know what to do with it yet. That's like still an exciting place to be. I'm not villainizing that. That's still, hey, that's great. But it seems like you guys have so much going on in Colorado about health that you have different initiatives that are at different points on that maturity spectrum. Some places we're building infrastructure to have something like this. And in some places you're chasing down real problems that Colorado citizens have. So would you just tell me a little bit about what does this look like on the ground? What does it feel like?
Stephanie can add a lot more to it because she's more on the ground than I am, she and her staff. But, we're just now starting to pilot this social health information exchange. So maybe on the ground, it might look like I go to the doctor and I need a certain medication because I have a certain illness that needs to be refrigerated. And I don't have any way to refrigerate my medication. So it doesn't do me a lot of good to walk out of the doctor's office with a prescription that ultimately isn't going to be effective. So the social health information exchange can help hook people up with those kinds of resources. If you're a diabetic and they tell you to follow a diabetic diet and you don't really know what a diabetic diet is, through the social health information exchange, they could perhaps hook you up with a nutritionist or some other kind of program that can help you. So it's more than walking out of an office with a prescription. It's more of a holistic look about how can we really maximize a person's health.
Those are gaps that I think have gone unnoticed for so long. I would not have thought of those things ever. Out of all of this, are there specific use cases you guys are pursuing?
Yes. So we really started with use cases that would impact the most vulnerable populations. Our initial four kind of focus populations are those experiencing homelessness, individuals with disabilities, and reducing barriers to care for individuals navigating substance use disorder and reconnecting individuals exiting incarceration to their communities.
Wow.
So really focusing on bolstering that data flow for those particular populations at this time, thinking through, one of our first kind of data source partners is Colorado's Homelessness Management Information System, or HMIS, that each state has one of those. Again, to your earlier point, just kind of at varying points of population data to, recommending or identifying gaps, identifying funding, things like that. So really partnering with our Department of Local Affairs, as well as, again, our state Medicaid agency, and then even partnering with what we call coordinated entry partners or communities of care. Of course, again, we love all these acronyms, COCs or CEs. So those are the folks who are truly the front lines working with individuals experiencing homelessness. And, that's a traditionally really difficult population data-wise as well, for a lot of reasons. But really focusing on, if this individual has already filled out a social needs screener yesterday and they walk into a different clinic today, that clinic does not need to screen them again. To our conversation about repeating trauma as well, right? Going through those screeners all day, every day, when you're just trying to get the basic services that you truly are entitled to, that's not how the system should be supporting people. And so that's where the COSHI really aims to move the data that's already there into the hands of providers who need it, rather than, again, kind of duplicating that work, putting that person through that again.
Okay. Because some of this is new, one of my questions is how do you ensure success of these programs? What are key focus areas? Where you have a hard time going to sleep at night, Stephanie? What are some of those concerns that you guys might have, and how are you reassuring the program?
I can start, and then Lieutenant Governor can add her midnight thoughts as well. But I think some of the challenges have been actually indeed on the data side. So it's like you knew, Jess, to ask this question. And that's where some of the less exciting work comes in, right? Or less flashy work as far as memorandums of understanding and data sharing agreements.
Yeah.
Really getting those to a place that are strong for the partners, for the state, and then for the system too. Again, this is a brand new system and it's the first of its kind. And so building trust is the most important thing here. And, data moves at the speed of trust and relationships, not at the speed of technology, especially in government.
Preach. That is a word. It's well said, because I'm going to interject for a second. Because Stephanie, I feel like you said, like when you were like, hey, actually the data is one of the things that's been complicated or hard. I sort of feel like that's the case because you guys have been so thoughtful about the people, because you've listened so well. Because I think most people, when we're talking about their story on this podcast, are talking about it's the people. It's always the team. It's always like that's the hardest thing to move. You guys have really done the work to anticipate that and spend a lot of time and energy hearing people across your state and understanding what the needs are, that I feel like you got to kind of head that off. Is that your lived experience?
Yes, absolutely. And so kindly put. So I really appreciate that. But you're right. We know that this is not an opportunity of if we build this system, they will come. Because this kind of data, especially social health data, is not yet really regulated. And so it's either the Wild West or nothing. And we're trying to build that path as we go down it, really leaning on our community partners and saying, how are you handling it? How do you see it? And also, more importantly, how do your clients see it? How do folks want their data to move? How do they want their data to speak for them? Or do they not? Do they want to speak first and have their data follow them? Because that's what happens now. And we have the option to flip that. But that's not always the right thing either. And so it's very nuanced. And I think Lieutenant Governor might have thoughts about that too, as far as technology getting kind of ahead of people or how we balance that.
Yeah.
Well, I think, behind the scenes, we're doing a lot of, you asked about success and making sure that we have our memorandums of understanding in place. So check that box. Data sharing agreements in place, check that box. Those are all really critical to the implementation of the program and to make sure that it works. And, building a first of its kind systems, we have to build trust. So, check that box. You have to make sure you have security in the technology. So, check that box. And so there's a lot of things that have to happen behind the scenes to make sure that this data sharing works. How we measure success is, first of all, getting all those boxes checked so that we have all that in place. And then making sure that, we see the one-on-one cases, this person got helped with this because of this system. And then you gather all that data together at the end and work on, more of a global look. So what policies need to change, what laws need to be implemented, those kinds of things. So if we can see some individual successes as we go and then also systemic wins down the road, I think that's how we'll measure the success.
Wow. It's so exciting, you guys. I'm so impressed. I mean, one of the things I'm curious about is, and Stephanie, you already talked about, some of the challenges you faced were some of the data challenges. Are there any other challenges you wanted to mention that were right up there with it?
I could go on for days. But I think one that I maybe teed up but didn't quite follow through on is that because this is a new system and it is very nuanced, a lot of times explaining Koshi in a way that resonates and is clear without getting too technical or too data focused has been a challenge, especially for our team. We get into the acronym soup, we get into, the state speak and everything like that. And so I think it's been a challenge and a gift to our team to have to flip that and share kind of the value first and the people first. And also being realistic about what this system is and what it is not. Because it can be a little bit vague, it can quickly become one-stop solution that's going to solve all of our problems. And I would love for that to be, this is a 10-year project. I would love for that 10 years from now for us to come back and say, we solved it. The reality is that we're doing the best we can with what we have in the bounds of regulations and reality. And that still, for a lot of folks, seems too good to be true, frankly. I do recognize what a privileged problem this is, that we have the opportunity to build such an exciting system that people don't believe us.
Yeah.
That it's going to be real. I think thinking through, especially coming in again as the state and saying, we're going to build a system that won't change your workflow, that can go between vendors, and that you may not even know you're using. You just may notice that your data is more complete. How would one do that? And luckily, that's what we have the privilege of doing. And so I think in a way, each release of this system will overcome a lot of the big challenges that we have, which are, will this ever happen?
Mm-hmm.
And will it work? Right?
Yeah. Well, and if I understand it right, I mean, one of you guys putting people first and listening first is really important, because in this exact situation, you have this challenge of you need individuals to sort of buy in with their data and say, hey, with my agency, I'm making this choice about my data. And you need the community partners, it sounds like, right? You need people who are also saying that. So there's a lot of, when you talk about memorandums of understanding and data sharing agreements, that is heavy, and that can take a minute. If you don't mind, one of the questions of curiosity I have is the leadership angle of kind of this podcast's point. Are there times now where that feels like a mountain that just gets taller every time you try to climb up? Like, how do you guys stay motivated? Because I imagine that can be hard.
Well, I think part of the way you stay motivated is keeping the end goal in mind, that ultimately this is going to improve access and quality of care for people. Keep that in the forefront of your mind, and, that really helps because, like Stephanie hit upon, some people are reluctant to have their data shared. That's one of our challenges. And providers and docs in their offices, they don't want to engage in anything that's going to make their lives more difficult. And so, making sure that, we assure them that this is actually going to help with their patient care and it's not going to be a burden and things like that. So keeping all that in mind and knowing that we're actually helping the providers and that we're helping the patients, I think helps us go to work every day. Right, Stephanie?
It absolutely does. I think the other thing is we have a nimble team who will keep working on this until the mountain is a molehill. And every day that we get even a small win, that's huge for us. The fact that we've been under contract for this build for less than a year and have gotten through all of those favored 3-letter acronyms, the MOUs and the DSAs, and again, the relationships are really what make it doable and what keep us going. If we have a day where we feel like we didn't quite get where we wanted to go, those somehow are the days that our partners speak up and say, hey, I had this great conversation, or I saw this presentation you all did, or, it could be anything. But I think that's where really building the community to support not only the technology, but truly kind of the movement that Lieutenant Governor and Governor have facilitated in this area is what keeps us going. Once, one of us might get tired and then somebody takes up that kind of cheerleader role. And so the bigger our community gets, I think the easier it is to keep going as well.
I'm really impressed. And I think even from a leadership perspective, I mean, Lieutenant Governor, is something that you said that for me it resonates as a leader is there are times where I can be so single-minded when I'm thinking about something that I'm told to achieve, that if you're on the way, you can be in the way. And the ability that you both have articulated to continue to stay committed to the vision, and that vision is inclusive of people that are on the way. That if you're a community partner and you don't want to use it or you're afraid, you're not in the way. You are part of the vision, and you guys are finding ways to continue to listen and stay committed and work in those relationships. I am so impressed with that leadership. So I know that we're kind of wrapping up on time. Is there anything we have not talked about that you guys want to make sure we do mention?
I think, Stephanie was talking about our use cases, and, the governor and I have been committed to a Colorado for all. So, I think what's really neat about the use cases that Stephanie's working on is that the fact that this would impact the most vulnerable populations first, including, people that are homeless, people with disabilities, people who are navigating substance use disorders, and people that are exiting incarceration in their communities. So kudos to Stephanie and her staff for focusing on the most vulnerable, because if we can address those populations, then everything else will be much easier. So I just want to talk about how, this is really important for a Colorado for All.
Well said. Stephanie, anything else you wanted to share?
I think that's the perfect closing note.
So if people want to learn more about this, where can they go to check in and check it out?
If people would like to learn more, they can go to the OHI website, which is oehi.colorado.gov.
Awesome. Okay, great. Thank you so, so much for joining us today and teaching us about leadership and tech and a little bit of health too. We really appreciate it. Thank you guys for listening. I'm your host, Jess Carter. To learn more about this important work, like they shared in the episode, please check out the links in the show notes. And don't forget to follow the Data-Driven Leadership wherever you get your podcast, rate and review, letting us know how these data topics are transforming your business. We can't wait for you to join us on the next episode.